All right, well, good morning, everyone. See, people are kind of creeping, maybe crawling back in this morning, so it's good to see you back. So this is the first full day of Sears. We started out yesterday with the South On, and then the Sears Symposium started the half day, so glad to have you back. And again, if you have any questions or anything's come up, please let me or Emily know. So I'm really pleased to start off with introducing our keynote speaker for this morning. And the keynote is going to be the Dillon Carnahan keynote speaker, which, if you don't know about that, a little background, the Deep South Center established, the ERC, established the Kenneth Dillon and Brian Carnahan Pilot Project Research Program and then the speaker series based on these two distinguished people in the field of industrial hygiene as well as other parts. So we're really pleased this morning to have our Dillon Carnahan speaker, Dr. Sarah Tamers, who's a health research scientist at NIOSH. She serves as the research program development and collaboration arm, as the coordinator of that rather, of the Total Worker Health Program and assistant coordinator of the Healthy Work Design and Wellbeing Program and coordinator of the Future of Work Initiative. So she wears many hats. She led the development of the National Total Worker Health Agenda, which we know is also a key theme of this symposium, and which is part of the National Occupational Research Agenda, or NORA, which is intended to define and prioritize total worker health research, practice, and policy, and capacity building activities for the nation. She also led the development of the NIOSH Future of Work Initiative research agenda, which is meant to help NIOSH scientists identify and prioritize the future of work activities. Her research interests lie in occupational safety and health, of course, total worker health, and the future of work, social determinants of health, which tie in closely, obviously, obesogenic behaviors, worker well-being, social networks and support, and cross-country comparisons. So the title of her presentation this morning is Total Worker Health. Work has got a lot to do with it. So I'm pleased to introduce Dr. Tamers.
Wonderful. Well, thank you for that introduction and good early morning to you all. It's really a pleasure to be with you here today, albeit virtually, so I very much appreciate the understanding and the flexibility. So as John mentioned, I do wear several hats at NIOSH, and I've been there for about 8 years now. Given the fantastic theme of this year's meeting, Total Worker Health, what does work have to do with it? It's mostly wearing my Total Worker Health hat that I'll chat with you a little bit this morning to try to shed light on that very important question. There we go. Excellent. So my understanding is today we have a range of attendees, which is wonderful. As I understand it, we have some students, some professionals, folks who are explicitly in OSH, and then very much beyond that, those who are doing research and in academia, as well as beyond, those who are familiar with Total Worker Health, and those who are completely new to it. So that's great. In order to meet the spectrum of Total Worker Health interests or needs, what I've done today is carve out the presentation in these 5 areas you see before you. We'll start with a little snapshot of Total Worker Health, especially for our newcomers to the field. We'll then move into a little bit of research and practice. So why is Total Worker Health beneficial? Why has it been successful? And what does that look like in the field? So a few simple examples, and then the outcomes that one can expect using a Total Worker Health approach. We'll then move into the application across worker safety, health, and well-being. And by that, what I'd like to do is demonstrate to you why NIOSH utilizes the Total Worker Health approach institute-wide across a number of other programs and initiatives. And then I'll highlight some of those for you today. And then importantly, what does the future of Total Worker Health hold? Where are we going in the coming years, in the coming decade? And to that point, some key resources to take us there, some existing and upcoming partnerships that will really be integral to these efforts, as well as some collaborative opportunities, because those will definitely be key as we move to the future. All right, let's start with that little overview of the total worker health approach, a little baseline here, a little foundation. So, starting with the definition, as you can see here, we define total worker health as policies, programs, and practices that integrate, that's a key word for us, integrate the protection from work related safety and health hazards with the promotion of injury and illness prevention efforts, and all this to advance worker well being. I know that can be a little bit of a mouthful when you first read that definition, so I would like to break it down for us all right now. So, in essence, total worker health, first and foremost, is about keeping workers safe. That is our foundation always. We then integrate to that. That's that key word, right? We then integrate to that the three workplace P's of policies, programs, and practices that grow health. And in doing so, we create worker well-being. A few key tenets I'd like to leave you with before we turn to the next section, which I think is these are really important if you're new to total worker health, but also serve as a nice reminder to how the total worker health approach perhaps is different from some other approaches. So first, what it is, and then second, just as importantly, really what it is not. So the total worker health approach examines how the workplace and work, not the worker. We start top down, so how the workplace and work can holistically influence a variety of workforce safety, health, and well-being issues and outcomes, and we'll take a look at what some of those are in just a moment. The total worker health approach always embraces voluntary and participatory interventions and absolutely protects workers' rights and privacy. Turning to what it is not. The total worker health approach never blames the worker. If you hear otherwise, it simply isn't total worker health, and then please bring that to our attention. The total worker health approach is also not consistent with any of those three workplace P's, right, that we saw, that discriminate against or penalize workers for their own personal health conditions, individual risk factors, and so forth, or create any type of disincentives for improving health. And then finally, the total worker health approach is also not to be confused with, let's say, traditional, siloed, so non-integrated worksite health promotion or wellness type efforts, that have been implemented without those baselines, without that foundation of safety integrated with health enhancing activities. All right, so there's our foundation for total worker health. A lot more on that. And so for those of you who are new to the field, if you're interested in learning more, we have a number of resources at your disposal, and I'll go over those in a little bit. But we have a lot of workshops and other type of tools and resources that can help build that foundation even more. But hopefully that will be sufficient as we build now to the rest of this morning's presentation. Now turning to the second section here on research and practice. So why, again, has the total worker health approach been so successful? Why is it needed? What's the motivation, the impetus, and why has it been successful? And then turning that research, that knowledge into practice. What does that look like in the field, in the trenches? And then again, what outcomes can be expected by utilizing a total worker health approach as opposed to your more traditional type of practices? So the reason the total worker health approach is needed and why it's been successful over 2 decades of research now, generally showing quite success, is because of several reasons. Here, first and foremost, we know that the workplace and work can heavily contribute to workforce safety, health, and well-being issues and outcomes, sometimes favorably, sometimes not favorably. We also know that there are these inextricable relationships that exist between all these different types of worker safety, health, and well-being issues, not just on, but also off the job. And additionally, and very much relatedly, we know, as demonstrated by this very simple pie chart here you see to the right of your screen, that we take our health and safety issues with us, right? We experience them in the work and the non-work setting for the most part. Because while we may wear our worker hats during only a portion of a 24-hour period, again, we don't generally leave some of these issues where we go, we take them with us during that 24-hour period. And so this is why time and time again, we see that the total worker health approach, by its very definition, by its very way that it is implemented successfully in a holistic, transdisciplinary type of approach, an expanded approach, that it's able to address in an integrated fashion these complex and synergistic risks that workers face, which then leads to better outcomes. Now, to help us bridge that knowledge into practice, we use a number of evidence-based tools. And what I wanted to do is highlight just two of those tools that we use quite widely in our efforts, at least in the Total Worker Health program. The first tool to help highlight the examples that we'll cover is our fundamentals of total worker health approaches. And as you see, it includes 5 fundamentals. This is a do-it-yourself workbook that's been very popular, not just with employers or those within organizations that are champions of safety and health, but also interventionists. What it allows you to do, again, in a very do-it-yourself way, is to see where you are, see where you want to go to get to total worker health, and then assess and evaluate, right? So pretty simple, pretty straightforward, but quite effective. The other tool, evidence-based tool that we use quite a lot is our hierarchy of controls applied to total worker health. So this may be familiar to some of you, not because of this particular hierarchy, but because it serves as its very similar companion piece, our traditional hierarchy of controls that we use in OSH. What this one does, it serves as an additional underpinning framework for the total worker health approach, really focused on getting us to worker well-being. But it has still that very much inverted traditional triangle, starting with the top-down approach. So utilizing this as we approach a total worker health intervention, for instance, we would begin by looking at what we could eliminate in the workplace of work that threatens worker safety, health, and well-being. We would then move to that substitution category of those 3 workplace Ps. We would then further move into the redesign or reorg or restructuring of various factors in the workplace and work, again, that threaten the spectrum of safety, health, and well-being issues. And importantly, then and only then is when we would move to those individual level pieces right at the bottom of the triangle. So in the form, for instance, of education or of encouragement, okay? One important point here as we move into those very simple examples is that the total worker health approach can certainly widely be used across different issues. And again, we'll see what some of those are in a moment. However, we heartily encourage the tailoring of any activity, a total worker health activity, specific to the job, specific to the occupation and industry, specific to those workforce needs. Because as I'm sure we all know, one size does not fit all. So keeping that in mind, let's now dive into those 2 very simple examples. So again, I've kept these simple, none of the additional bells and whistles here, just to give you a sense of what this might look like in the trenches. So here we have one example looking at MSDs, huge prevalent issue, as we know, among patient care workers who are certainly affected by this, among other issues. So with that fundamentals of total worker health approaches in mind and the hierarchy of controls, what we would do, for instance, here is we might drop down from that elimination bucket all the way down to reorg. And we might reorg some aspects related to perhaps work hours, limiting work hours so that we could limit overexertion, which we know to have a relationship with MSDs. We would then integrate to that some psychosocial health 3 Ps, right? Policies, programs, and practices, because we know that psychosocial health type of issues can have a link from a psychosomatic standpoint with MSDs. We would then integrate further some ergonomic consultations, for instance, to help make sure that our patient care workers are lifting and standing and sitting in such a way to not exacerbate or contribute to MSDs. And then lastly, only lastly, recall that hierarchy of controls, We would then integrate further those individual level pieces, such as in the form of management, self-management strategies that our workers, our patient care workers could use, not just at work, but also at home, right? Because recall that pie chart, we take these issues generally with us no matter where we go. Moving on now to that second example, this time looking at sleep and fatigue, another unfortunately huge prevalent issue with our workforces and certainly among shift workers. So here again, with the fundamentals and the hierarchy of controls in mind, we might begin with some safe staffing. So making sure we have enough staff on hand so that our shift workers, we're not putting in too long work hours, which we know to be associated with sleep and fatigue issues. We would then integrate to that some health supportive policies. So perhaps in the form of paid leave or enforcing breaks, things that, again, we know to be highly linked to sleep and fatigue and affecting shift workers. We might then integrate to that further some physical environment modifications. So if we're able, for instance, to construct a little area for nap time, depending on the type of shift work, or just to rest, again, as we think about things that contribute to sleep and fatigue, small, simple steps sometimes is all it takes, sometimes with very little to no resources to really make incremental steps that lead to lasting changes. And then, and only then, again, at the end, would we lastly include that self piece, that individual level worker piece in the form of sleep training or education or resources and so forth. Okay, so 2 examples. What can we expect then as far as outcomes from these and many, many other examples out there? Well, as you see before you, you can expect quite a few gains. And this is, again, after 2 decades of research now that we're seeing pretty similar outcomes, successful outcomes. There are many more I could have added to this slide, which I didn't, and I included a link there where you can go and explore many additional publications with many additional outcomes. But these are sort of the big ticket items of what we can expect. So the promise of total worker health is vast, and importantly here as well, it extends, we find, not just to the employer or the worker, very importantly, but to the worker's family, with a potential trickle effect beyond that to the community and society. So again, the promise can extend in many beneficial ways. All right, I would now like to turn our attention to applying the total worker health approach across worker safety, health, and well-being issues. So here, as I mentioned at the top of the hour, what I would like to do is sort of explain why NIOSH uses this so prevalently across the Institute, as well as highlight a few examples, which I hope will help with some of your current efforts or perhaps some upcoming ones as well. Okay, so the chief reason why the total worker health approach is used institute-wide is because it very nicely and successfully builds on already existing traditional NIOSH efforts. Don't forget that NIOSH has 10 sectors focused on industries, 7 cross-sectors focused on safety and health, and 20 core and specialty programs focused on special emerging areas and emphasis areas. And so there are a lot of jobs and occupations and industries and worker safety, health, and well-being needs that are being addressed. So the breadth is huge. And the total worker health approach is able to broaden on those existing traditional, now 50 years, 51 years this year's efforts of NIOSH to include a well-being lens, which is increasingly important in the work that we do at NIOSH, as well as other factors in a transdisciplinary and holistic way that impacts various risks, exposures, and hazards that trickle both on and off the job. The total worker health approach also, by its very definition, as we saw, offers very holistic, comprehensive solutions, not just, again, in a traditional sense to create safer work, which is certainly extremely important, but also higher quality work and better designed work. The total worker health approach is also able to confront really a spectrum of workplace, and work risks, exposures, and hazards that also impact an equal spectrum of workforce safety, health, and well-being issues. And then finally, very much in the tradition still of NIOSH, which is focused on research and then offering tailored-based recommendations based on said research, the total worker health approach very much does that, but also builds upon that to inform additional pillars, as we'll see, really with the aim of creating holistic, healthier organizations, improved worker well-being, and as we saw, beyond that as well. Okay, the other reason why NIOSH likes to advocate the total worker health approach across the Institute is because, as you see from this slide, there are a number of issues that are relevant to advancing worker well-being using a total worker health approach. So if this isn't familiar to you, this is our third iteration of such a table. I led this one with, of course, the participation of a number of team members and partners. And so what you see here are really the current and emerging areas that we identified in 2020. So that's the latest version in 10 different categories that you can see: prevention and control of hazards and exposures, built environment supports, as well as community supports. We certainly have compensation and benefits, which is a big one. Healthy leadership is absolutely integral. The organization of work, policies parsed out specifically, the enforcement, especially of really sound integrated policies. Technology, of course, because we are living in the future of work arrangements with non-standard work arrangements being a big priority for NIOSH for some years now. And then certainly our shifting workforce demographics. So as you see, a number of issues. And again, this is the most salient list that we developed. There are more that we can add here. So think about those 10 sectors and 7 cross sectors and 20 core and specialty programs that we have at NIOSH. A lot of possibility here where the total worker health approach can be quite useful and has demonstrated to be so. And then finally, the other reason why NIOSH applies the total worker health approach institute-wide is because undoubtedly tomorrow's workers will likely continue to face risks, hazards, and exposures from work, some that are traditional, some that are new, and some that we don't even know about yet. And increasingly over the years, and this was pre-pandemic, but certainly since, there's been an increasing call by external partners to develop and to implement these really next level, what I call OSH 4.0 or 5.0 approaches to address these complex concerns that workers are facing that are even more blurred by work and non-work factors. So the total worker health approach, again, has been doing this for quite some time and is really prepared to do this now when we think about the future needs of our workforce. So, as I mentioned, I wanted to give you a couple of examples of these applications NIOSH-wide of the total worker health approach. Here's one looking at productive aging. So we have a total worker health hosted center called the National Center for Productive Aging and Work, or NCPA for short. So as the name implies, what this center does is look at the life course, the working life course, and how it can help through a number of resources, a number of evidence-based tools, help workers age more productively, work more productively. Now, there is certainly a big portfolio of work for our older workers, but also for that entire spectrum, to include our younger workers who also face additional risks because of a lack of safety and health training and being sometimes in higher risk occupations. So this is one where we have a lot of employers and managers come and ask, how do I deal with these situations? How do I really make my workforce, that sometimes includes 5 generations, how do I address all of their needs with limited resources? So this has been a very productive and fruitful center. And if you're interested, again, I've included the webpage there. We don't have time to go into a lot of detail, but there's a lot more information on each of the web pages that I've provided. And of course, you can always email me separately if you'd like to learn more. Okay, here's a second effort, a NIOSH-wide effort using the total worker health approach I wanted to bring to your attention. This was created a few years ago before the pandemic and focused on opioids. Since then, it has expanded to include other areas of substance misuse and abuse. So, for instance, cannabis. So, across 5 or 6 internal working groups, the work here is being done to create and identify tools and resources for employers and workers to help safeguard workers and also to help bring them back to work when there are such issues. So this is a growing portfolio with a lot of stakeholders involved, both within the walls of NIOSH and beyond. And the Total Worker Health Framework has provided really a great opportunity to look at these issues that have traditionally been looked in more siloed ways. So doing so in that total worker health integrated fashion. Okay, here's another effort here with our mental health effort with our health workers. So the goal here is, as you can see, improving the mental health and well-being nationwide for our health workers in 3 areas of prevention, awareness, and intervention. So this is one of our newer institute-wide efforts, but as you might imagine, it's been evolving very, very quickly. And so this is done across an internal work group with many participants, external and internal partnerships, certainly. And we focus on this in 5 ways, each one with its own subset of a number of steps. So first, really looking at that burden. What does it look like when it comes to mental health outcomes? Then again, something that NIOSH has asked time and time again, best practices, recommendations, tools. So building up a repository there. Our partnership efforts, integral to everything we do at NIOSH and certainly to this effort as well. And then looking at data, screening tools, really aiming to get to that sustainable change. And then finally, something that we're really excited about and that should launch in the not too distant future is a nationwide social marketing campaign on this issue. So again, this is a newer effort, but it's evolving really quickly. And so again, if this is something you're interested in, I don't have a web link on this because that's how new it is, but you're free to certainly email me and I can put you in contact with Dr. Tom Cunningham, who leads this and others, to learn more and to get involved if you'd like to as well. That's always welcome. And here's the last effort that I wanted to bring to your attention this morning. Again, institute-wide effort that uses the total worker health approach. So this is our NIOSH Future of Work initiative. And then the vision is quite simple here: to prepare our workers for a safer, healthier, and more productive future. One of the first steps that we did here to do so was create a set of 9 future of work priority topics and an accompanying set of 63 subtopics. So that's that middle table that you see there. Our future of work priority topics for this initiative include organizational design, technological job displacement, work arrangements. We also have artificial intelligence, robotics, technologies, and then finally demographics, economic security, and skills. So these are parsed out, but very much overlapping categories. To the right of your screen, you also have a foundational paper that we wrote that's available to you open access, and it dives into all of these future of work priority topics and subtopics. And then to the very right of your screen here at the bottom, you have something that we just published about 3 months ago. That's our NIOSH Future of Work Initiative Research Agenda. What that does is sets out goals and objectives for NIOSH. So it was done by NIOSH for NIOSH, but with external input from partners and stakeholders. And the reason for that is that we wanted to make it publicly available because we hope it will inspire the larger OSH and beyond ecosystem with their own future of work efforts, which is certainly a topic that is on many people's minds these days. All right, so a segue from the future of work onto the future of total worker health. So what do the coming years for total worker health, at least from a NIOSH total worker health program standpoint, what are those future years going to look like? Well, we've certainly had in our mind, and this was before the pandemic, but certainly the last couple of years have really spotlighted the world over the importance of the workplace and work for worker safety, health, and well-being. It's as though the world has woken up, perhaps maybe for the first time, really understanding what work's got to do with it. And so in the Total Worker Health Program, we really want to capitalize on that momentum, keep that momentum going. So that worker well-being isn't just still a luxury or a perk or a happy accident for some, but that it truly becomes an opportunity and a right for all workers. So that is at the heart of everything that we do. In order to look forward, we certainly have to look to where we've been, where we are, what we keep, and what has emerged. The National Total Worker Health Research Agenda, which John mentioned earlier on, is a NORA, National Occupational Research Agenda, featuring goals and objectives for the nation to help move forward the portfolio of work, the discipline that we call total worker health, in 4 overlapping areas of research, practice, policy, and capacity building. Those are our total worker health pillars, our 4 pillars. So this was published in 2016, as you can see, but we still have 4 years on the clock. So there's more to do here. And I encourage you to take a look if you are interested in any of these 4 pillars to help us, again, on behalf of the nation with NIOSH, to continue to move the field forward. But we continue, despite still having years on that clock, to look at what the future holds. Where do we want to be? Well, we have 20 years under our belt. Next year, the NIOSH Total Worker Health Program turns 20. So again, the future has been on our mind a lot. We have evolved over the last 20 years considerably. You can read all about that in 2 evolution type papers at the bottom of your screen, with another one hopefully coming down the pipeline this year or next. So looking towards where we want those next 20 years to be, or at least those next 10 years to be. Well, overall, we would like to see more efforts, more activities across those 4 pillars. And we would like to see that nationwide, really having total worker health become a nationwide effort. We believe that such efforts will really benefit from some key threads that we see time and time again, increasing the success of such efforts. These include healthy leadership, active worker participation and involvement continuously at that, multiple and flexible, safe and healthy options, because as we touched on, we know very much that one size does not fit all. And then those collaborations are so key. They've been key to our past, to our present, and to our future. So really building those with varied partners, some of which we haven't yet to identify at all levels. So really getting more of a 360 holistic experience. Looking more concretely now to what those next 10 years could look like in the Total Worker Health Program, what we'd like to see is the field, the total worker health field, be even more positioned than it already is to prepare employers and to prepare workers for these really accelerating, changing times. And in order to do that, we really have to offer even more new and updated practical solutions. This is something we get asked about time and time again. A new issue emerges, where's that practical solution? So we really have to be on the ball here and have those ready, with, of course, the needs of workers always at the heart of everything that we do. We'd like to see the total worker health field that paradigm shift from what it is still to a status quo, that work diminishes one's life as opposed to a status quo where it can improve it. In total worker health, we don't just want the worker to come to the workplace or work safer and healthier. We want the worker to leave work feeling safer, feeling healthier. So we want to push that even more. We would like to see an emphasis on more integrated, but one size does not fit all of those 3 workplace Ps to, again, meet these diverse and changing and accelerating and evolving needs impacting all of our workers. We'd like to see an expansion of the current concept to embrace some issues that are sometimes not necessarily included in more traditional OSH models and paradigms. So, for instance, discrimination or the ever-increasing wage gap or economic insecurity and other elements like that. And then, as I mentioned, a collaboration, partnerships, We certainly want to nurture and strengthen our existing ones, but let's push beyond the boundaries, which we've already been doing in total worker health for some time, but even more so to tap disciplines, to tap fields, to tap some of those steep factors, right? STEEP factors, beyond those traditions to really get more and more partners, new and upcoming, at the table to confront these really complex concerns that workers continue to face. Given that we have folks who are particularly interested or focused on research, I did want to pull out some total worker health priority areas, priority issues, emerging areas as we think about the next 10 years. So that table that I showed you, the issues graphic, as we call it for short, that certainly will continue to be updated over time. But parsing out here, just to give you a sense of what we're looking at over the next 10 years from a research, but also beyond, right? Thinking about those 4 pillars, there's overlapping, certainly applicability there. So overall, we want to see more of an emphasis on new and existing. We can't forget the long-standing, still existing workplace and work factors impacting the new and existing workforce safety, health, and well-being issues and outcomes on and off the job. So for instance, let's have wanting to see more of a focus, on psychological stress, burnout, and other types of harms that arise from different types of hazardous work schedules. Unhealthy supervision is a huge one for us. We want to see more in that area. And then technology, as we covered, the future of work. We've been in that for a while. It's not going away, although it is changing. That's another conversation. What are some of these consequences from technology? What are some of those unintended consequences? For instance, as we see with more job flexibility options, which we're happy to see, but coming sometimes at a cost because of some of the technologies, the AI surveillance that's being used. So what are those going to look like? And what are the outcomes, the impact and outcomes for our workers? Moving us down to those job flexibility options. What are they now? But what are those really going to look like in perhaps a more hybrid workforce? And importantly, what's that work-life fit sweet spot, right? Between the pros and the cons, the beauty, the wonderfulness of the job flexibility, but some of the technology that can come at a cost. Importantly here too, we'd really like to understand more about the employer versus worker preferences. We see a big distinction sometimes on that, right? With well-intentioned employers, sometimes rolling out policies, programs, and practices that don't actually meet the needs of their workers. So wasted resources, despite the well-intentioned. So we want to see some emphasis there. Tailored interventions continued again in that one size does not fit all approach, seeing tailored interventions for our highest risk and most vulnerable workers. And importantly, again, as we think about accelerating and changing times and how things evolve, what are those groups going to look like, and how can we tailor quickly our interventions to meet their needs? ROI and VOI, is so important here. We really want to see an investment in ROI and especially VOI as we make the business case for total worker health. Ethics is important in everything that we do, and certainly here as well. More ethical competencies, training certainly, and then incorporating those in either new or existing standards of practice. There's a nice paper that came out last year about this by Bonnie Rogers and Anita Schill for those interested, but we want to see even more here. And then in general, certainly as you might expect, more research on growing and post-pandemic issues, some of which, again, we don't even know quite yet what those are going to look like. And so this is just a listing of some of the ones that we're already looking at, that we're planning on investing more time in moving forward. All right, so for the last years, 10 years or more, we have been planning for many activities to build that future of total worker health that I mentioned. So one such activity is our upcoming 3rd International Symposium to Advance Total Worker Health. So we're very excited about this. This happens every 4 years, so if you get a chance to go, I certainly would recommend it. Unfortunately, the deadline to submit a proposal has passed, but you're very welcome, even if you don't present anything. We really have folks from those 4 pillars of research, practice, policy, and capacity building in attendance, and it does have international representation. per the title. So I'd encourage you to attend. This will be in October at NIH, hopefully in person or at least a hybrid type of event. At that time, something else that's been in the works for, 10 years or more, we're finally launching our Total Worker Health Professional Society. So this has been an ongoing effort for some years, and that will be the place to learn all about it. But of course, if you're not at the symposium, don't fear. We'll have a lot of information about that and how you can join on our webpage. And then this has been something in the pipeline, for probably 10 to 15 years. And so very much in our next 10-year plan as well. We're not there yet, although we've been taking some baby steps there, developing a total worker health journal. So we think this is going to be really useful, not just for total worker health, but for other inter and transdisciplinary areas, right? If we think about bringing different disciplines, even more disciplines, I should say, and fields and partners to the table to build certainly research, but research to practice and other activities. All right, so in order to build that future, we really need to use some existing resources, some more hot off the presses, build new ones. We really want to harness and foster and create new partnerships in total worker health and beyond, and then really also build those collaborative opportunities. I mean, this will be key in the next 10 years, in the next 20 years, the next stages, the next chapters of total worker health. So we touched on a couple of tools at the beginning of the hour. We have many, many more, not just through NIOSH, but through many of our external partners, and we'll chat about that in just a moment. We also have some promising practices that are really popular with our employers, but also others learning about total worker health. These are essentially little case studies of how total worker health has been successful in organizations, in programs, and we collect those and post those for every year. And then we certainly have publications, and we're building and we're building and we're building. Internal to NIOSH and very much our external partnership publications and research are featured. I do include 2 links there for you for the publications. The second one, the bottom one, is a special issue that we just closed last month. So this is available to you, 30 papers, all open access, featuring research, commentaries, reviews on how the total worker health approach and accompanying healthy work design and well-being strategies can be used to address the future of work. So again, that's available to you. The latest and greatest of total worker health from a number of our partners can be found at that link. This is a tool that we've been working on for nearly 10 years. We're finally there. We launched it last year, and we really hope that this will be used to build, again, that next chapter, the next 10 years of total worker health. It's the first ever survey of its kind. It is, of course, free for public use for you, and it characterizes quality of life using an earlier created worker well-being measure across the 5 dimensions that you see listed here. We very much hope that it will be used for, again, a number of areas, whether for intervention development, to accumulate and share data, certainly, create benchmarks, potentially set policy, which is something we would like to see, national total worker health policy even, and further knowledge. So a lot of potential there. And we're really hoping to see, again, launched last year, hoping to see more and more of this being used. Something also that we think is integral to the next chapters of total worker health is something that we actually developed and published a few years ago, as you see there in 2019. It is a textbook on total worker health. It is being used by a number of our certificate and academic programs, which is really wonderful to see. So this is really a part of our capacity building pillar. In particular, we really would like to see this being used, and I'm sure there will be another textbook at some time, but this will be very integral, again, to those future chapters of total worker health. Here are some of those formal education opportunities for students and professionals. You see the different kinds here, and I know some of the attendees are involved, which is wonderful. I do want to make sure to say that though it's wonderful and gratifying to see these formal endeavors, and again, we hope to see more of these nationwide, there are certainly informal opportunities for those of you who might be interested, but where a formal setting maybe just isn't in the cards for you at this time. So if you'd like to learn more, you have a link there, or again, you're very welcome to email me and I can direct you to these kind of informal ways where you can become educated and trained on total worker health. I did certainly want to pull out our current total worker health certificate and degree training programs. I hope soon I'll have 3 or 4 or 5 slides with all this content. And again, it's really wonderful to see this growing in a relatively short time. I mentioned partnerships are integral to all that we do. That's integral to NIOSH efforts and therefore to total worker health program efforts across whether it's research, surveillance, you name it, whether it's strictly focused on total worker health or not. We work with a number of partners, and again, these have been vital to our past, are to our present, and to our future stages of total worker health. So we are eternally grateful and hope to work more with these partners and more that have yet to be identified. Notwithstanding those partners aside, I did want to highlight for your attention 2 entities in particular that we work with more intimately. That includes our Centers of Excellence for Total Worker Health. Last year, we funded 4 more centers, so now we have 10 centers, one which is designated as a mental health center. We also have almost 60 affiliates. So our Centers of Excellence, our academic institutions, our affiliates do include some academic institutions, but we have government entities, we have labor, we have not-for-profit. So on their behalf, I would like to offer collaborative opportunities when it comes to research to practice, and beyond. Again, these will be very important building our next stages, and it will take everyone coming to the table. There are a number of ways you can even just passively connect with total worker health, whether you're new to total worker health or seasoned and want to sort of keep your eye on what's going on. Our Total Worker Health in Action e-newsletter is a nice way to have a publication 4 times a year arrive in your inbox, where you can find out especially what's going on in the extramural community when it comes to total worker health. We've been building very quickly in a relatively short period of time, and we hope to see a lot more. As I mentioned, whether it has to do with the presentation today or any other effort, you are very welcome to email me. That is an open invitation. I'd be happy to assist you with any of your needs. Our office is officially called Office of Total Worker Health Research, Support, and Coordination. So I am here, we are here to support and help coordinate whatever needs you have. And that's all I have this morning. Thanks very much for your time and attention. I'd be happy to take any questions at this time.
One question I have, in thinking about, like, with this regional symposium, we're continuing to try to build the collaborative capacity here in the Southeast, and also, with integrating in total worker health, and, we have the Carolina Total Worker Health Center here at UNC, as you're aware of, that we're bringing in that as well. But what can we be doing? I'm thinking about like fostering collaboration, research, and we've got several new up-and-coming researchers and academics, practitioners here in the room. What can we be focusing on from the NIOSH perspective and regarding total worker health?
Sure. Well, so we covered a number of, as we think about the 10-year plan, the future of total worker health, how to position yourself, perhaps from a research and research to practice standpoint. There are some concrete areas, topical areas, as we covered. I guess I would suggest if you're starting from somewhere, that's already something. So what I mean to say is if you have a particular focus that you are interested in that is within your portfolio, but you're wondering, well, I'm not using the total worker health approach, how can I apply this here? As hopefully you were able to see, there are a number of issues that can be tackled utilizing the total worker health approach. So it's more finding out or understanding where you are and how you would like to apply that. And if you need assistance with that or want to be connected to one of our NIOSH programs, particularly focus on the topic of interest in your research or practice portfolio, that is a link we can easily make and help bridge those connections, those collaborations, not just internal to NIOSH, but also externally as well on whatever topical area pretty much that you're involved in. So I wouldn't want to necessarily direct someone on to a particular topical area other than those that we've showed the direction that we're going. I would say wherever you are is great from a safety, health, and well-being standpoint, and let us help assist you with those collaborations based on where you are and where you want to go.
Okay, great. Thank you. We have a couple questions here from the audience. Go ahead.
Sure.
Awesome. So, excellent presentation. I appreciate the information on the total worker health approach. Just one quick question. In my research, I haven't really seen any trends or dropout rates for organizations or employers who are attempting to implement this approach. It seems like as an employer or an organization, it's more of a cultural change to really implement these kind of like policies and procedures, as you mentioned, with the 3 Ps. So, with the high commitment level, and I would imagine at times not really results almost immediately from the efforts that are being made. Have you seen a lot of dropout rates or I should say among employers or organizations that are trying to implement the TWH approach?
Thank you for your question. So a short and quick answer is I'm not sure what that dropout rate is. And now you've intrigued me. So I'm going to look into that and see if we have anyone who's really been assessing that. We certainly have studies, of course, that look at based on that particular study and are trying to recruit a number of employers. And so how many within the framework of that particular study have stuck with it and how many have dropped out. But sort of on a more collective basis, in a totality, if you will, of total worker health attempts, that I'm not sure about. You touched, though, on some important points. One of the things that we chat about with our employers, say, for instance, or those who are in charge of OSH type of activities who come to us on behalf of the organization and want to roll out total worker health, but don't know how to get started and so on. Certainly, first of all, there are distinctions, as I'm sure you can imagine, based on the size of the organization, AKA the resources, right? Large organization versus your small or even medium-sized businesses. And I will say that we have a decent amount of literature on small to medium-sized businesses. So if you're interested in some of the additional challenges from a total worker health approach, go to that link, that special issue that I mentioned, among others. You can certainly find others, but that's one place where you can see sort of the disparities that we deal with. That speaks a little bit to your question. But, certainly one might entertain the fact that with more limited resources, more limited time, limited personnel, not even perhaps having an OSH person on hand in some organizations, in some small businesses, which is absolutely the case for many, you might find more likeliness to maybe not stick it out. But here's the important point I think to make. One, culture is very hard to change. As we know, it takes a long time. But what we've seen is for those who are really motivated, who really understand and support their workforces, they're willing to do just about anything and try just about anything to get there, which is where the business case becomes really important, right? To make sure that employers understand the benefits, the decades-long benefits of this. But what we tell those who come to us is, hey, you start where you are, right? Maybe I don't know if you can see me, maybe you're here and total worker health is here. But even if you just get here, even if that's all you can manage with the tools that we have, that's still an improvement. It's about making incremental little steps sometimes to finally lead you to where you want to go, which is that comprehensive, holistic, truly total worker health. But every step that you take to get there you will see benefits. It does take a shift from short-term benefit thinking to long-term benefit thinking, and we know that can be tricky in pretty much everything that we do. But that's essentially so when it comes to the dropout rates, what we see are those who get a little bit of taste to it, even if they stay right there, they're more likely to stick with it and then build upon that and build upon that. So it's not going to be overnight. But we see that as being a benefit to many, and for some of them, without much resources, right? Some things you can do are really quick fixes. So, but I will look into that question of if we have a collective sense of dropout rates. So thank you for that.
Thank you, Dr. Demers. We have another question, one more.
Hi there. Thank you for the talk. I had a question regarding kind of the integration of total worker health in simple terms. Have you seen, I'm not sure if you're familiar with the concept of Industry 4.0 at all by chance?
Mm-hmm.
Okay. Have you seen any companies that kind of are able to exemplify the integration of total worker health and Industry 4.0? Because that can really bring forth a lot of communication and a lot of open channels for possibilities.
Yeah, that's an area. So obviously you've been in attendance. I'm going to take it for the whole talk this morning. So we have a future of work initiative, where we're looking at Industry 4.0 or Industry 5.0 now, right? Coming back to a hopefully more human worker centered, so that collaboration more between technology, between machine and the human worker as well. So we're still exploring that. To be clear, the future of work and such matters have been looked at in different ways at NIOSH for some time now. This new initiative, now almost 3 years old, is a way to sort of bring all those efforts together, coordinate them, and then build upon them. So more to come on that. I would say we don't know quite yet. We do have a number of folks looking at Future of Work Matters, advocating the total worker health approach, which is what we do with the initiative. But I think the coming years will really be able to tell us more what the applicability is. However, our sense is that these will be a nice overlay for one another, given not just the past, but what we're seeing boots on the ground. So I guess I would say stay tuned. You have the webpage for the Future of Work Initiative, and I hope we'll be able to update with that kind of positive, hopefully successful outcomes that touch on Industry 4 to 5.0.
Okay. Do we have, got one more question.
Thank you for the talk. We have a number of center directors here and pilot funded projects here. I was just kind of wanted to pick your brain on what would be some advice you would give to those folks where total worker health is a very comprehensive kind of approach that may lend itself to larger funding opportunities. What would you suggest are some ways that you could, or advice you would give for pilot feasibility projects using the total worker health? What would that look like in your eyes?
Great question. Short answer, please contact me. I'm just looking at the time. I know you have to. I have some ideas about that, and I have some team members and Office of Extramural Program folks who would be able to shed some good light on that. So if that is something seriously being contemplated, I would be happy to connect you and talk about that further, because there are a lot of possibilities there. I certainly wouldn't tell our Total Worker Health Center directors what to do. They do just fine and then some on their own, but there's room for a lot. And as we saw with the future of work, with the post-pandemic era, there's going to be a lot more, a lot different, perhaps coming down the pipeway, and we need to be ready for that. We need to be several steps ahead. So we are thinking about that at all times, and again, happy to talk about that in more depth separately.